So infectious diseases pharmacy, simply put, are pharmacists that take care of patients, and they specialize in drugs that treat various infectious diseases. So these drugs can be generally classified into what are known as antimicrobials. And antimicrobials consist of antibiotics, which work against bacteria, antifungals, which work against fungi, and antivirals, which work against viruses. And generally speaking, our job as infectious diseases pharmacists are to ensure the optimal use of antimicrobials for our patients. So this is choosing the right drug, because different drugs may work or may not work against various organisms, the right dose, because different organisms may require a different dose, and different disease states or infections may require a different dose, and then ultimately the optimal duration, because different disease states or infections may require different lengths of therapy. Yeah, so I chose infectious diseases because it was the area I was drawn to. And you know, it's cliche, but you know, when you're in training within pharmacy, you're going to be exposed to a lot of different areas, and infectious diseases was that specialization that just made me feel warm and fuzzy inside. And I think, you know, when you treat infections, it's really like a puzzle that you're trying to solve. With most disease states, pharmacists have to worry about the patient and the drug. And you have to think about the pharmacokinetics, or what that patient's body does to the drug, and also the pharmacodynamics, or what that drug does to the patient's body or the disease state. But when you have infections, there's a third added layer of complexity, and that's the pathogen that you also have to think about, or that bacteria, fungi, or virus. So not only are you thinking about the pharmacokinetics and pharmacodynamics between that patient and drug, but you also have that organism or that pathogen that's causing the infection. And you also have to think about the pharmacodynamics between the drug and the pathogen. So how does this antimicrobial kill or slow the growth of that organism? You know, does it work best if you dose higher doses, or does it work best if you give it more frequently? You also have to think about the patient's immune system, because whether or not a patient has a functioning immune system could drastically change the way that you treat various infections. And then finally, antimicrobial resistance mechanisms. So bacteria and fungi, etc., they can become smart, and antimicrobials that we once had in our arsenal may not work best for different pathogens anymore. And there's numerous different antimicrobial resistance mechanisms that you have to think about when treating these infections. So the patient, the drug, and the pathogen, and all those things that encompass that we just talked about is why I think it's so interesting. So my typical day changes every day, and I think that's why I enjoy my job so much. So I'm an assistant professor within the College of Pharmacy. So one of my primary roles is educating and training student pharmacists to become competent pharmacists once they graduate. But the other part of my day is a clinician within the Children's Hospital. And I like to think of my clinical responsibilities split up into two parts. One is rounding with the infectious diseases consult service. So if you think of your primary care physician within the community, they generally take care and manage all of your different disease states. But if there's a complex medical issue, say a complex cardiac issue or heart issue, that your primary care physician may want a little more guidance or help with, they'll send you to a specialist, like a cardiologist in the community. And I like to say the same types of things happen within the hospital. So there's a primary team within the hospital that takes care of the entire patient and manages all of the various disease states. But if there's a complex issue, you know, a cardiac issue, they'll consult the cardiac team. And in my instance, if there's a complex infection, they'll consult the infectious diseases team. So I spend my mornings looking up all of the patients that are on the infectious diseases consult service, and then I go and physically round with the pediatric infectious diseases team. That consists of an infectious diseases physician and the infectious diseases pharmacist, which is me, medical students, medical residents, pharmacy residents, and pharmacy students. And we go and physically see each of those patients with complex infections and ensure that they're on the most optimized therapy. The other side of my clinical responsibilities correlate to antimicrobial stewardship, and that's optimizing the use of antimicrobials, not just for those complex patients with those complex infections, but for all of the patients within the healthcare system. So any patient with a potentially uncomplicated infection, or any patient receiving antimicrobials, we review those to ensure that they're receiving the optimal drug, the optimal dose, and also the optimal duration of therapy. And some ways that we do that, just a few examples, is reviewing any patient within the hospital that has any organism within their blood or their cerebral spinal fluid. We ensure that they're on the optimized therapy. We create guidelines for common infections that non-infectious diseases specialists may see, things like COVID-19 and urinary tract infections and things like that. And on the academic side, I spend a lot of time teaching and mentoring students. So I provide various lectures throughout the year to pharmacy students in clinical microbiology and infectious diseases therapeutics and clinical pharmacokinetics. And with that comes with creating quizzes and assessments and exams. And each time I give a lecture, I want to make it better for the next time I give it. So I like to enhance and optimize those lectures each time after I give them. And lastly, a big part of what I do is research. So it's answering clinical questions that may not have a definitive answer yet. Yeah, so any students that would be interested in a career path in infectious diseases pharmacy, the first thing I'd recommend is to do the very best you can within pharmacy school. So that's not just within classes that have to deal with infectious diseases or antimicrobials. That's all of the classes that you have. Get involved in extracurricular activities. So that's community service, organizations, and a very big organization that I love are the Society of Infectious Diseases Pharmacists, or SIDP, and that's an organization that's dedicated to the optimal use of antimicrobials. And try to get involved with some research. So whether that's writing case reports or presenting posters or conducting original research with a mentor, all of these things within school are going to set you up for success, to be as competitive as possible to attain a residency. And residencies are not required to be an infectious diseases pharmacist, but they're a little extra push of training that's going to set you up for success to again be the best applicant you can be when it comes to applying for an infectious diseases pharmacy job.